Have you ever wondered if there could be a breakthrough treatment for autism that might help your loved one communicate better, engage more socially, or simply lead a more comfortable life? As researchers continue to explore potential treatments, one area that has shown promise is the use of Leucovorin. This video will break down what Leucovorin is, how it works, and what the latest clinical research says about its use in autism treatment. Before we proceed, please be advised that this video is for educational purposes only. It is not meant as a substitute for clinical advice or evaluation. Let's get started. Leucovorin, also known as folinic acid, is a form of folate, a vital B vitamin necessary for numerous bodily functions, including DNA synthesis and repair, cell division, and growth. Unlike regular folic acid, Leucovorin is an active form of folate, meaning it can be readily used by the body without requiring conversion. This characteristic makes Leucovorin especially beneficial for individuals with certain genetic variations or metabolic disorders that impede the conversion of folic acid to its active form. Research has indicated a potential link between folate metabolism and autism. Some individuals with autism have been found to have abnormalities in their folate processing pathways. One such abnormality involves the presence of folate receptor autoantibodies. These autoantibodies can bind to folate receptors in the brain and block the transport of folate into the central nervous system, leading to a condition known as cerebral folate deficiency. This deficiency may contribute to the neurological symptoms observed in autism, such as epilepsy, motor disturbances, and sleep disturbances, to mention but a few. Leucovorin can bypass these blocked receptors and provide the necessary folate directly to the brain. By increasing the availability of active folate in the central nervous system, Leucovorin may help alleviate some symptoms associated with autism. Before delving further into the use of Leucovorin, it's essential to understand the Folate Receptor Autoantibody test. This test is used to detect the presence of folate receptor autoantibodies in the blood. Identifying these antibodies can help determine whether a person might benefit from Leucovorin treatment. The test involves a simple blood draw and is usually recommended for individuals with autism who exhibit symptoms consistent with cerebral folate deficiency, such as developmental regression, motor abnormalities, or seizures. Early studies have provided encouraging results regarding Leucovorin's potential benefits for individuals with autism. One of the first pilot trials was conducted by Dr. Richard Fry, a child neurologist, and his colleagues. This study included 44 children with autism, some of whom tested positive for folate receptor autoantibodies. The children were administered Leucovorin over a period of 12 weeks. The results showed significant improvements in verbal communication and overall behavioral symptoms in children who received Leucovorin compared to those who received a placebo, also known as a sugar pill. To build on the initial findings, researchers have conducted more rigorous, double-blind, placebo-controlled studies. One notable study published in the journal Molecular Psychiatry in 2016 involved 48 children with autism. The participants were randomly assigned to receive either Leucovorin or a placebo for 12 weeks. The study found that those treated with Leucovorin showed significant improvements in communication, social interaction, and attention compared to the placebo group. The effects were more pronounced in children who tested positive for folate receptor autoantibodies. You might be wondering about the safety and efficacy of long-term use of Leucovorin treatment. A follow-up study conducted by the same research team evaluated the long-term effects of Leucovorin in children with autism over a period of 6 months. The results demonstrated sustained improvements in verbal communication and behavior without significant adverse effects. This finding suggests that Leucovorin may offer a safe and effective treatment option for long-term management of autism symptoms, given the promising findings from clinical research. Several guidelines and recommendations have emerged regarding the use of Leucovorin in autism treatment. These guidelines are as follows. It is recommended that children with autism who exhibit symptoms consistent with cerebral folate deficiency undergo the folate receptor autoantibody test. Identifying the presence of autoantibodies can help determine whether Leucovorin treatment is appropriate. The optimal dosage of Leucovorin for autism treatment can vary depending on individual factors such as age, weight, and the severity of symptoms. In clinical studies, dosages have ranged from 2 milligrams per kilogram to 50 milligrams per day. It is crucial to work with a healthcare provider to determine the appropriate dosage and monitor the child's response to treatment. Regular monitoring and follow-up are essential when using Leucovorin for autism treatment. Healthcare providers should assess the child's progress, conduct periodic blood tests to measure folate levels, and adjust the dosage if necessary. Monitoring for potential side effects, although rare, is also important to ensure the treatment's safety and efficacy. Several studies have indicated that children with autism who have cerebral folate deficiency may exhibit more severe neurodevelopmental issues. These can include profound speech and language delays, intellectual disabilities, and motor coordination problems. Leucovorin treatment, by addressing the underlying folate deficiency, has shown potential in mitigating these issues, leading to improvements in developmental milestones and quality of life. Leucovorin is sometimes used in combination with other treatments to enhance its efficacy. For example, combining Leucovorin with behavioral therapies such as applied behavior analysis, ABA, or speech therapy can create a more holistic approach to managing autism symptoms. The synergistic effects of these combined treatments may offer better outcomes than any single treatment alone. Parents and clinicians have reported subjective improvements in children with autism following Leucovorin treatment. These observations include enhanced verbal communication, better social engagement, reduced irritability, and overall improved behavior. While anecdotal, these reports provide valuable insights into the real-world effectiveness of Leucovorin and highlight the importance of individualized treatment plans. While Leucovorin treatment holds promise, it is important to note the following. Not all individuals with autism will benefit from Leucovorin treatment. The presence of folate receptor autoantibodies is a crucial factor in determining its efficacy. Therefore, it is important to conduct appropriate testing and work closely with healthcare providers to assess suitability. Leucovorin is generally well tolerated, with minimal side effects reported in clinical studies. However, some individuals may experience mild gastrointestinal symptoms, such as nausea or diarrhea. Monitoring and communication with healthcare providers can help manage any potential side effects. Leucovorin treatment is not a standalone cure for autism. It should be considered as part of a comprehensive treatment plan that includes behavioral interventions, educational support, and other therapies tailored to the individual's needs. Collaborating with a multidisciplinary team can optimize outcomes. In summary, Leucovorin has emerged as a promising treatment option for individuals with autism, particularly those with folate receptor autoantibodies. While Leucovorin may not be suitable for everyone, it represents a valuable tool in the quest to improve the lives of individuals with autism. Thank you for joining us today. We hope you found this information helpful and informative. If you have any questions or would like to share your experiences, please leave a comment below. And don't forget to like and subscribe. Until next time, stay safe and stay healthy.